My parents were hippies, and after they had my sister in San Francisco, they decided to leave the city for a more family-friendly place. They spun a globe and landed on the Virgin Islands. By the time I was 11, we were still there, living on a houseboat. After work and school, we'd all meet up in hammocks strung around on the deck of the boat. Since we were floating far from land, my dad and I would pee off the side of the houseboat carelessly. One morning, Dad woke early and watched the sunrise. Looking down into the turquoise sea, he saw a plume of his own blood. Dad was diagnosed with bladder cancer. The hospitals on the island were terrible. Even the doctors told my dad to leave. We moved back to the States and settled again in Northern California. After a few years of struggle, the cancer was gone. But a question nagged me. Why should a family be forced to uproot because quality health care isn't available where they live? I once worked in a hospital testing people's lung health. People would come in with diseases caused by smoking, caused by chemicals they inhaled at work, caused by air pollution, and all day I would think to myself, how futile, if only we could keep them from ever needing to arrive at a hospital in the first place. A person's health status encompasses almost every social justice issue I can think of. If someone's poor, they're more likely to be sick. If someone is discriminated against, they're more likely to be sick. If someone has a bad job, they're more likely to be sick. And to improve someone's health, I feel that you must think at once about all of these factors. That's what public health is trying to do. Keep people from going to a hospital needlessly. And if they ever do need a hospital, they should have a good one nearby. My dad's still healthy, but healthcare is still a problem. He and my mom are thinking about moving to Mexico, where, when they get old, they can afford healthcare.